increased in many European countries and in the United States. High blood pressure, high cholesterol, smoking, family history of CAD, diabetes, being overweight. Talk to your doctor if you have one or more of these risk factors. 2. Stroke. High blood pressure, family history of stroke, smoking, especially when combined with birth control pills, being African American, being female. Some stroke risk factors can be minimized with preventive care, medications, and lifestyle changes. 3. Lower respiratory tract infections. 4. Chronic obstructive pulmonary disease. Cigarette smoking or passive smoking, lung irritants such as chemical fumes, family history, with AATD gene linked to COPD, history of respiratory tract infections during childhood. Small, there is no cure for COPD, but its progression can be slowed with medication. Ben Bei Duong Ho Hap Kung La Mo Can Ben Fa Bien Hin Ne. 5. Tracheal, bronchial and lung cancer. In the developing world, researchers predict an 81 to 100% increase in respiratory cancer rates due to pollution and smoking. Cancers of the trachea, bronchus, and lung can affect anyone, but they are more likely to affect people with a history of smoking or tobacco use. 6. Diabetes. Diabetes is a group of diseases that affect the production and use of insulin. In type 2 diabetes, the pancreas does not produce enough insulin or the insulin cannot be used effectively. People in low to middle income countries are more likely to die from complications of diabetes. Adding more fiber to your diet can help control your blood sugar. 7. Alzheimer's disease and other dementias. Alzheimer's disease is a progressive disease that destroys memory and disrupts normal mental functions. Over 65 years of age, family history, inherited disease, genes from parents, existing mild cognitive impairment, Down syndrome, unhealthy lifestyle, previous head trauma, separation out of the community or interact poorly with others for long periods of time. There is no way to prevent Alzheimer's disease. 8. Dehydration due to diarrhea. Diarrhea is when you have 3 or more loose stools in a day. If diarrhea lasts more than a few days, your body has lost too much water and salt. About 760,000 children die from diarrheal diseases each year. Living in an area with poor sanitation, lack of clean water, malnutrition, weakened immune system. According to UNICEF, the best prevention method is good hygiene practices, good birth. 9. Tuberculosis. Tuberculosis is one of the leading causes of death among people living with HIV. TB cases have decreased by 1.5% per year since 2000. Diabetes, HIV infection, lower body weight, being close to other people with TB, regularly taking certain medications such as corticosteroids or drugs that suppress the immune system. The best prevention against TB is the Bacillus Calmette-Guérin (BCG) vaccine. 10. Cirrhosis. Cirrhosis is the result of chronic or long-term scarring and damage to the liver. Damage can be the result of kidney disease, or conditions such as hepatitis and chronic alcoholism. Chronic alcohol use, accumulation of fat around the liver, non-alcoholic fatty liver disease, chronic viral hepatitis. Stay away from behaviors that can lead to liver damage to prevent cirrhosis. Likewise, you can avoid non-alcoholic fatty liver disease by eating a healthy diet rich in fruits and vegetables and low in sugar and fat. In addition, you also need to perform annual health checkups to detect abnormalities early so that timely intervention can be initiated. With this package, you will be checked by the doctor on urine, liver function, kidney function, blood pressure measurement, scan, overall screening. Through the examination results, the doctor will give you some advice. The examination process at the hospital is always of a high standard with the support of a team of specialized doctors and modern equipment.